If you have heartburn and you think you already have it under control, I want you to pay close attention for the next few minutes, because there is a good chance that at least 3 of the habits I am about to describe are things you do every single day, convinced they are harmless or even good for you. None of them look dangerous. None of them come with a warning label. And that is exactly the problem. The habits that keep acid reflux alive and active are rarely dramatic. They are small, ordinary choices repeated so often that they stop looking like choices at all. So before you decide that your reflux is just something you have to live with, let's look honestly at what you are actually doing every day, because the answer to why your symptoms keep coming back might be hiding in plain sight. Gastroesophageal reflux disease, or GERD, is not simply too much stomach acid. That is the version most people carry around in their heads, and it is incomplete. Your stomach is supposed to be acidic. It needs to be, in order to break down food and kill off bacteria you swallow along with your meals. The real issue in reflux disease is not the acid itself, but where that acid ends up. Between your esophagus and your stomach sits a ring of muscle called the lower esophageal sphincter. Think of it as a one-way gate. Food and liquid go down through it into the stomach, and then it is supposed to close firmly behind them, keeping the acidic contents of the stomach exactly where they belong. When that gate weakens or when it opens at the wrong moments, stomach acid slips backward into the esophagus, a tube that has almost no protection against acid exposure. That backward movement is reflux. When it happens often enough or aggressively enough to damage the lining of the esophagus or seriously disrupt your daily life, it becomes GERD. Here is what most people never fully absorb. The lower esophageal sphincter does not fail because of one single dramatic event. It weakens gradually, worn down by repeated pressure, repeated relaxation at the wrong time, and repeated exposure to substances and situations that make it less effective. That means the habits you repeat automatically, day after day, without ever questioning them, are doing far more to shape your reflux than any single meal ever could. Let's go through 6 of the most common ones, because chances are you will recognize yourself in at least a few of them. The first habit is lying down soon after eating, even if it is just a short rest on the couch or an early bedtime after dinner. This one feels harmless. You ate, you feel a little heavy, so you sit back or lie down to let your body relax. But gravity is doing quiet, constant work for you throughout the day, keeping the contents of your stomach pulled downward, away from the esophagus. The moment you go horizontal, that help disappears. Stomach contents can shift and press more easily against the lower esophageal sphincter, and if that sphincter is already a little weak, acid finds its way up. This is why so many people notice that their worst symptoms show up not during the day, but at night or right after a nap following a big lunch. If you routinely eat dinner and then sit reclined on the sofa within an hour, or you go to bed less than 2 to 3 hours after your last meal, you are recreating the exact conditions reflux thrives in night after night without ever connecting the dots. There is a reason this particular habit is so easy to miss. Most people do not experience heartburn the moment they lie down. It often takes 20 or 30 minutes, sometimes longer, for the burning to build. By the time it shows up, you have already forgotten that you finished dinner not long ago, and the symptom feels random, almost like it came out of nowhere. That delay is part of what makes reflux so hard to diagnose on your own. The cause and the symptom are separated by just enough time that your brain does not naturally connect them. If you want a simple test, try this for 1 week. Eat dinner at your normal time, but stay upright, sitting or standing, for a full 3 hours afterward before lying down. Pay attention to whether your symptoms that night change. Most people who try this are surprised by how much of a difference it makes, and that difference is usually the clearest proof they will ever get that timing, not just food choice, is driving their reflux. The second habit is treating antacids as your long-term management plan instead of as an occasional tool. Over-the-counter antacids and acid reducers are useful, and there is nothing wrong with using them when you need quick relief. The problem is what happens when occasional quietly turns into daily, and daily turns into, "I've been doing this for 2 years and never mentioned it to a doctor." When you rely on these medications constantly without ever finding out why your reflux is happening in the first place, you are treating the smoke alarm instead of the fire. Symptoms get muted, so you feel like things are under control, while the underlying mechanical problem, whether it is a weak sphincter, a hiatal hernia, or something else, continues undisturbed. Worse, some of these medications change the environment of your digestive tract in ways that are meant for short-term use, not indefinite daily habit. If you find yourself reaching for an antacid almost automatically, several times a week, for months at a time, that is not a controlled condition. That is an unexamined one. I want to pause here for a moment because if what I just described sounds uncomfortably familiar, you are not alone, and this channel exists specifically for people in that position. If this video is helping you see your own daily patterns more clearly, take a second right now to subscribe and tap the like button. It genuinely helps this information reach more people who are dealing with the exact same confusion about their symptoms, and it costs you nothing but a couple of seconds. The third habit is eating meals that are technically healthy, but heavy in fat, and assuming that because the ingredients are wholesome, the meal cannot possibly be a problem. Avocado, olive oil, nuts, full-fat cheese, fatty cuts of salmon. These are foods with real nutritional value, and I am not telling you to avoid them entirely. But fat, regardless of whether it comes from a fast food burger or a beautifully plated salmon fillet, slows down stomach emptying and can relax the lower esophageal sphincter. A stomach that empties slowly stays full and under pressure for longer, which increases the opportunity for acid to be pushed backward. So a large dinner built around avocado, olive oil, and a rich sauce can trigger just as much reflux as a plate of fried food, sometimes more, precisely because people eat larger portions of it without a second thought, believing the healthy label protects them. The lesson is not that these foods are bad. It is that portion size and timing matter just as much as ingredient quality when your sphincter is already compromised. Think about the difference between a modest serving of grilled salmon with vegetables and a generous fillet swimming in butter sauce, paired with a side of avocado and a handful of nuts on top of the salad. Nutritionally, the second plate might still look reasonable on paper. Digestively, it is a much heavier load, asking your stomach to hold onto a large volume of fat-rich food for an extended period, all while you are likely still sitting at the table or moving to the couch shortly afterward. The combination of a large fat load and an upright to recline transition right after the meal is, in many people, the single most reliable trigger for a bad reflux night, more so than any one specific ingredient. This is why some people report that reflux seems to get worse around holidays or celebrations, when meals tend to be larger, richer, and followed by extended time sitting or lying around afterward. It is rarely one dish causing the problem. It is the combined weight of the whole meal, its size, its fat content, and what you do with your body in the hours that follow it. The fourth habit is exercising, particularly doing core work like sit-ups, crunches, or heavy lifting shortly after a meal. Physical activity is one of the best things you can do for your overall health, and I always want to be clear that I am not discouraging it. But certain movements increase pressure inside the abdomen very quickly. Bending forward, contracting the abdominal muscles hard, or lifting something heavy pushes upward on the stomach. If your stomach is still full from a recent meal, that upward pressure has somewhere to go, and it often goes straight through a weakened lower esophageal sphincter. People who work out on a tight schedule right after lunch, squeezing in a session before an afternoon meeting, are frequently the same people who cannot understand why their reflux seems to flare up specifically around exercise. The fix here is not to stop exercising. It is to shift the timing, giving your stomach real time to empty before you put pressure on it. The fifth habit is wearing tight waistbands, shapewear, or belts cinched high and firm around the abdomen, whether for comfort, for posture, or for how clothing looks. This is one of the most overlooked contributors to reflux because it feels entirely disconnected from digestion. But constant external pressure on the abdomen works the same way internal pressure from a full stomach does. It compresses the stomach from the outside, and that compression pushes contents upward toward the esophagus. People who wear compression garments for long stretches of the day, or who tighten their belts firmly after a big meal because their pants suddenly feel snug, are applying steady pressure exactly where they should be relieving it. If you consistently loosen your waistband after eating because it becomes uncomfortable, your body is already telling you something about the pressure you are placing on your digestive system. It is worth listening to that discomfort instead of just adjusting the belt and moving on. This habit tends to affect certain groups more than others without them realizing it. People who wear structured workwear, fitted dress pants, or high-waisted garments for long shifts, and people who wear postpartum or post-surgical compression garments for extended periods, often report a noticeable uptick in reflux symptoms during exactly those stretches of the day or those months of recovery. The pressure does not need to be extreme or painful to have an effect. Even moderate, sustained compression around the upper abdomen, held for hours at a time, is enough to tip the balance for someone whose lower esophageal sphincter is already working at reduced capacity. Simple adjustments like choosing a slightly looser fit for the hours immediately after a meal, or swapping a tight belt for suspenders or a slightly higher rise, non-compressive waistband, can make a measurable difference without requiring any change to diet at all. The sixth habit is trying to sleep with your reflux under control by stacking a couple of extra pillows under your head, rather than actually elevating the upper body from the waist up. This distinction seems small, but it changes everything. Piling pillows under your head and neck alone often just bends your body at the waist, which can increase abdominal pressure on the stomach rather than reducing it, while doing very little to keep acid from traveling up the esophagus. What actually works is elevating the entire upper body from the hips up using a wedge, an adjustable bed frame, or blocks under the head of the bed frame itself so that gravity is genuinely working in your favor throughout the night. People who have tried the pillow trick and found it useless are often not wrong that it did not work. It usually does not because it is solving the wrong problem in the wrong way. I want to ask you something because I think it says a lot about how common this condition really is. Wherever you are watching this from right now, whatever city or country, type it in the comments below. I ask because every time I do this, the comments fill up with people from completely different parts of the world describing the exact same nightly routine, the exact same confusion about a symptom they thought was unique to them. Seeing how widespread this really is tends to help people take it more seriously, and it helps me understand who is actually watching and struggling with this. Now, understanding these 6 habits matters, but understanding why they matter medically matters even more, because reflux that is left unmanaged is not just uncomfortable. It has consequences that build quietly over time. Chronic exposure of the esophagus to stomach acid can lead to inflammation of the esophageal lining, a condition called esophagitis. In some people, that repeated irritation triggers changes in the cells lining the esophagus, a condition known as Barrett's esophagus, which is monitored closely because it carries an increased risk of esophageal cancer in a subset of patients. I am not telling you this to frighten you unnecessarily. Most people with reflux will never develop these complications. But the difference between someone who manages their reflux early and effectively and someone who lets it run unchecked for a decade is often exactly the kind of habits we just walked through, repeated without awareness day after day, year after year. There is also a quieter cost that people underestimate: sleep. Reflux that flares at night does not just wake you up occasionally. It fragments your sleep in ways you might not even notice consciously, because you fall back asleep quickly after each episode, but your body never gets the deep, restorative rest it needs. Over months, that kind of chronic sleep disruption affects concentration, mood, immune function, and even how your body regulates hunger and weight, which can then feed back into worsening reflux. It becomes a cycle. Poor sleep contributes to habits that worsen reflux, and reflux worsens sleep. Breaking that cycle usually does not require dramatic intervention. It requires identifying which of these ordinary daily habits is quietly feeding it and making a deliberate change. So what does an effective approach actually look like, beyond simply removing these 6 habits? The first step is timing your meals with intention. Try to finish eating at least 3 hours before lying down, whether that is for a nap or for bedtime. This single change alone resolves a significant portion of nighttime reflux symptoms for many people, because it gives the stomach real time to empty before gravity stops helping you. The second step is separating physical exertion from meals. If you exercise regularly, and you should, schedule intense or core-focused workouts either before a meal or a couple of hours after one, not immediately following it. The third step is rethinking portion size rather than only ingredient quality. A smaller plate of a fattier, richer meal is often much easier on your esophagus than a large plate of the same food, even if both are nutritionally excellent choices. The fourth step is paying attention to what you wear, particularly after meals, and giving your midsection room to breathe rather than compressing it under a tight waistband. The fifth step, if nighttime symptoms are a real problem for you, is investing in genuine upper body elevation while sleeping, not just extra pillows under the head, but true elevation from the waist up. And the sixth step is treating antacids as a signal, not a solution. If you are using them regularly, that is information your body is giving you, and it deserves a real conversation with a doctor rather than a permanent workaround. It is also worth saying clearly that everyone's reflux is a little different. Some people are highly sensitive to caffeine and barely notice fat. Others can drink coffee all day with no issue but cannot touch anything spicy without paying for it that night. Because of this, one of the most useful things you can do is keep a simple log for 2 or 3 weeks, noting what you ate, when you ate it, what you did afterward, and when symptoms showed up. Patterns tend to emerge quickly once you actually write things down, and those patterns are far more reliable than general advice, because they are specific to your body and your daily routine. If any part of what you just heard made you think about your own evenings, your own workouts, or your own nights lying in bed wondering why the burning came back again, that reaction matters. It usually means there is a concrete, identifiable habit behind your symptoms, not a mysterious, unsolvable condition. Before we wrap up, if you have not already done so, this is a good moment to subscribe and hit like, because we cover exactly these kinds of practical, evidence-based breakdowns regularly, and if this approach is useful to you, there is a lot more here that can help you understand what is actually happening in your body. It is important to say, too, that self-management through habit changes has real limits, and knowing where those limits are is part of taking your health seriously. If you are experiencing reflux more than twice a week despite adjusting these habits, if you are having difficulty or pain when swallowing, if you are losing weight without trying, or if you notice any sign of bleeding, those are signals that go beyond what lifestyle changes alone can address, and they call for a proper medical evaluation rather than more home experimentation. GERD is manageable, and for the vast majority of people it is very manageable, but managing it well means being honest about what your daily habits are actually doing to your body, not just about what symptoms you are covering up in the moment. So let's bring this back to where we started. If you recognized yourself in more than one of these 6 habits, that is not a failure on your part. Almost nobody connects healthy fats, a quick nap after lunch, a snug pair of pants, or extra pillows to something as specific as acid reflux, because none of it is intuitive. Reflux is quiet in its causes and loud in its consequences, and that mismatch is exactly why it gets misunderstood and mismanaged so often. The good news is that once you can see these patterns clearly, changing them does not require a complicated overhaul of your life. It requires small, specific, deliberate adjustments to things you are already doing anyway, timing your meals differently, moving your workout by an hour, choosing true elevation over a stack of extra pillows, and treating your antacid use as a conversation starter with a doctor rather than a permanent fix. Take what you learned today and look honestly at your own routine over the next few days. You do not need to change everything at once. Pick the one habit from this list that felt the most familiar, the one that made you think, "That's exactly what I do," and start there. Small, consistent changes to the right habits tend to produce results far faster than people expect, precisely because those habits were working against the body the whole time without anyone realizing it. There is more to understand about how gastroesophageal reflux disease develops, how it is diagnosed properly, and what real treatment options exist beyond just avoiding trigger foods, and we will keep breaking all of that down here, one practical episode at a time. If today's video gave you a clearer picture of your own symptoms, stay close, because the next one goes even deeper into what is really happening inside your body when reflux becomes a chronic pattern instead of an occasional inconvenience.